Hello, my name is Dr. Harpinder Shevchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire, and I'm here to answer some of the questions regarding oral health and systemic health. So, one of the questions that I do get asked is, how does my oral health affect my heart? Actually, there's a big link between your oral health and your heart health that we have come to know in the past recent years. Been lots of studies on it that link the condition of your mouth, your gums, especially your gum health, your periodontal health, that's what we call it, between your heart health. So if there's a lot of inflammation in your mouth, it's going to affect your heart as well too. So we highly recommend to all our patients to make sure that your gums are healthy, you're free of gingivitis, which is the inflammation of the gums. If inflammation is present in any part of the body, it is going to affect rest of the parts of the body as well too. So again, if there's inflammation in one part of the body, it is going to affect the rest of the body as well too. So we highly recommend that you go do your checkups every 6 months. Your dentist, if they or your hygienist, if they ask you to be seen more than 6 months, like in between 3 month intervals, 4 month intervals, because it depends on every patient. So you want to make sure your oral health is top notch to make sure your heart health is top notch as well too. Another question that I do get asked is, can my oral health affect the diabetes management? Yes, certainly. There are many studies have been done. There's lot of research has been done for linking between the oral health and your systemic health. And diabetes is also one of them as well too. Patients who have a lot of inflammation in their mouth, possibly some infection in the gums, they have a difficult time managing their diabetes as well too. So we always recommend make sure that when you are pre-diabetic, whether you're pre-diabetic or you are battling diabetes with various treatments, you want to make sure that your gums are healthy as well too, so you can maintain your diabetes levels. They are stay under control. You are managing your diabetes much better if you're having a good oral health as well too. Another question that I do get asked is, why is dental care important during pregnancy? So the importance of dental health, it's regardless, but during pregnancy, because there are lots of hormonal changes happening in the body, so that also affects your gums as well too. They in turn they're interlinked. You want to make sure you are free of inflammation, because if there's inflammation in one part of the body, it's being released, all that inflammatory markers are going through your bloodstream all over in your body. And when you're pregnant, you certainly want to make sure that there's no impact on the baby to be born because of your oral health. It has actually, many studies have come up recently that link the mother's health, oral health not being to the point where it should be. And if they are not keeping their oral health, leading to premature birth, low weight birth babies as well too. So if you're pregnant, you certainly want to make sure that you're making visits to your dentist, you're keeping your gums healthy. Not only you're making the visits, you're maintaining your hygiene at home as well too. So another question that I do get asked is, can poor oral health affect my immune system? Yes, very much so. There have been many recent studies which show the link between inflammation in your mouth and how your immune system works. Any inflammation in the body is a trigger for your immune system. It's a spike up that, okay, there's some foreign agents coming and I have to ramp myself up. So a lot of times we see the inflammatory markers, with that's how your inflammation and your immune system is measured in your body. So if you have a lot of inflammation in your mouth, in your gums, you have a gingivitis, or you have infection as well too in your mouth, which is called periodontitis, that inflammation and all is being traveling throughout your bloodstream, and your immune system is attacking it. So sometimes it could trigger some other inflammatory responses as well too. So you definitely want to make sure your oral health is kept up to very, very normal. You're free of any gingivitis, you're free of periodontitis, so you can avoid any systemic conditions that can come from that. I hope I was able to answer some of your questions regarding oral health and systemic health. If you have any other questions, please feel free to call us at 603-926-8827, and you can reach us on our website as well too, www.smilesbythecnh.com, and we will see you there.